and welcome to Healthwire Media. I'm Sneha Kumari with you, and you're watching our very exclusive interactive session. On the World Kidney Day, we are in conversation with Dr. Anuja Porwal, who is an additional director of nephrology at Fortis, Noida. Welcome to Healthwire Media, ma'am. First of all, I would like to welcome you on our interactive session. So, ma'am, किडनी से रिलेटेड बहुत सारे ऐसे सवाल लोगों के मन में रहते हैं, स्पेशली जब से कोविड आया है और किडनी प्रॉब्लम हैज बीन वेरी अ कॉमन इशू. जो लोगों के मन में बहुत सारे मिथ्स भी रहते हैं कि कितने ग्लास हम पानी पिए कि वी कैन keep our kidney healthy, or for recovered COVID patients, there are a lot of questions that people have in their mind. So my first question for you, ma'am, is it safe for recovered COVID patients to donate their kidney? What do you want to say about this?
See, COVID infection is like any other viral infection which predominantly affects our respiratory system. So before considering patient for kidney donation, the patient should be essentially healthy and symptom-free and infection-free as well. And it is considered that usually the COVID patient clears COVID virus within 2 to 4 weeks. In fact, now it has been found that even after 10 days of contracting COVID infection, the patient is not viremic as such. So any patient who has recovered from COVID infection and it has been 4 weeks after recovery, we can consider that patient for kidney donation, because kidney donation for him as well as for recipient will be safe in this case.
Okay.
See, any viral infection can cause some damage to the kidney, but this damage is acute and a reversible kind of damage. So there is no harm in donating the kidney once you are recovered from COVID infection. It's like a flu. Once you are recovered from it, then you are safe to donate a kidney. This question has definitely come up because many COVID patients have developed kidney involvement. So the patients usually have fear that my kidneys got involved when I contracted COVID. So now will I be affected throughout my life? So the answer to this is that this is acute kidney injury. Acute kidney injury, as soon as the patient is non-viremic, the patient is asymptomatic and he start getting better, the kidney functions start getting better.
Right.
If you do not have any underlying kidney disease beforehand, if you have any underlying kidney disease, then definitely it might stay for some time. So it is safe for them to donate their kidney usually after 4 days if they have recovered from a milder illness. If it has been a severe illness, then definitely, depending on their condition, it might take up to 3 months also. We might consider them after 3 months once they are completely recovered. But there is no residual damage which will be done to the kidney if they have healthy kidney to begin with.
All right. Oh, and how much safe it is for them to donate it after recovery of COVID-19?
See, kidney donors are after donation, they are complete. Kidney donation is completely safe. In fact, there is hardly any medications which they get after donation. And there is worldwide data which shows the kidney donors have got more life expectancy than the normal patients of their age group. It is because after kidney donation, the patient becomes much more aware and start incorporating healthy lifestyle. So they are much more conscious than the general population regarding their health issues. They keep monitoring their blood pressure. They target adequate diabetes control and other things. So that is the reason, because of adopting these healthy lifestyle, their life expectancy is much longer than any normal individual. Plus, whenever there are kidney donation, there is no effect on the kidney function. Sometimes it has been seen that donors are slightly at higher risk for developing high blood pressure after 10 years of donation. So these patients need to be on regularly monitoring their blood pressures. Plus, whenever we have 2 kidneys and they are made normally, we have 2 healthy kidneys, after 12 years of age, we are able to donate them easily, and our body functions will be taken over by a single kidney, and that too in a healthy way.
So, ma'am, is there any connection between COVID-19 and kidney effects or kidney-related problems? As we have seen that COVID patients have already suffered from heart problems, but as it is said that COVID-19 affects the other organs of the body too. So, what is the relation between COVID-19 and kidney? If you want to say something.
See, kidney COVID virus, as I narrated earlier, that COVID virus is like any other viral illness and any other infection. Whenever it is severe in nature, it tends to affect all organs of the body. So kidney is no exception. However, usually kidney involvement in the milder cases is mild, and if they do not have any underlying kidney disease, it tend to recover as the infection gets cured. However, there are second set of infection which develops in kidney patients who are already having kidney disease, and like patients who are on dialysis, who have undergone transplant, and any other patients also who have got kidney disease, but that is not up to that extent. It's not advanced up to that extent where they require dialysis as transplant.
Yeah.
These patients' underlying immunity is much lower than the normal population. These patients are much more prone for the COVID-19 related kidney involvement.
Yeah.
So whenever such patients has contracted COVID illness, the outcome and the severity was poor in these patients, and even the renal involvement was much higher. Whereas normal healthy individual, if they tend to have renal involvement, it was usually transient and recovered as they got recovered from the COVID infection. Because any viral infection tend to cause inflammation inside the kidney, which can affect its function transiently and increase creatinine or can disturb your renal functions.
Okay.
But usually it is cured. As soon as the patient is recovered from the illness, they get better.
Okay. And ma'am, is it also seen that, a person who has not had any kidney problem before has seen any issue after recovering from COVID-19 or after infected by COVID-19? Have you seen in your journal?
Yes. In certain number of patients, it has also been seen that they did not have any kidney disease before contracting this infection. See, any infection, if it is severe, it tends to damage all organs and the kidney as well. And if the infection is that severe, sometimes they tend to cause a lot of damage to the kidney and other hemodynamic parameters, that this acute kidney injury is prolonged and gets converted into the chronic kidney disease later on. Because any acute kidney injury puts a scar to the kidney. And of course, if the insult or the injury was severe, or more severe kind of a nature, or more prolonged in terms of recovery, then definitely they might have some underlying kidney damage once they recovered from the COVID.
Okay.
So so coming back to the first question, in such substantive cases, I told you before considering any patient for donation, we tend to evaluate them thoroughly regarding all these aspects which I have narrated.
Yeah. Okay. And ma'am, are they eligible? This is one of the major question people ask. Like, if I have had COVID, so am I eligible to donate kidney if I have been recovered from it? So there are a lot of myths, and I don't know what other questions people have in their mind. If you want to clear something on this.
So you want to know basically how to assess the eligibility for kidney donation. Any individual 18 years to 60 years of age have any underlying diabetes or any other underlying chronic disease which can affect their kidneys later on. Like there are many multi-system disorders, connective tissue disorders. They tend to affect many organs of the body, including kidney. So the donor should be essentially healthy. There should not be any comorbidities present in him. However, we perform many tests before considering the patient for kidney donation. Through those tests, we find out that patient is healthy, and only then we consider that patient for donation.
Yes. There's one question, ma'am, that what is the recovery period after donating kidney, and what can the donor, how can the donor return to normal activities after donating their kidney?
See, after kidney donation, we call it donor nephrectomy. The patient can return to their work in like weeks' time. They are in the hospital for usually 4 to 5 days. They start walking very next day of operation, and they are discharged on post-op day 4 or 5 at majority of the centers. Okay. Then they are required to have some rest at home. Of course, it is not bed rest. They can do their normal routine work even at home. However, they are advised not to do any rigorous or aggressive exercise or any heavy workout or involve themselves in a very rigorous kind of work for next 2 weeks. After that, they can resume their normal professional duties. They can get back to their work. They can do everything which they were doing earlier, the donation of kidney. So, and these donors do not require any long-term medications. Only thing which is prescribed to them is 4 to 5 days of antibiotics, and after that they are through. Long-term activation, do not require any dietary restrictions, and yes, lifestyle modification at certain age. We definitely emphasize that they should be adopting and maintaining healthy lifestyle.
Yeah. And one more question people ask regarding this is that if I donate my kidney and in later time if I need one, then what should I do, or what we know about this?
See, that is usually a myth that if a person has donated and they will require a kidney later, they will require a kidney later to whom? For themselves. It is very, very rare because the donor usually remains healthy, their kidney functions remains normal. But yes, if they require kidney later on, then definitely they have to find a related donor in their family.
Okay.
But if we are speaking in terms of that same donor who has donated a kidney requires a kidney for himself or herself, and it is very rare. Huge donors have very good life expectancy and a very good function, kidney functions later on. But yes, due to some other reasons, suppose during some accident or some other things, they get trauma to their kidneys and somehow it is non-functional due to any infection or any obstruction or anything which comes up new as a newer disease, then they can get a kidney from their blood relatives who are like in the inner circle comes the immediate blood relatives like parents, spouse, brothers, sisters. In the second circle, grandparents, cousins, the first cousins, they can donate the kidney. And another option is cadaveric registration. So there is a cadaveric registry which is running entire across the India, and every hospital has their cadaveric list through which they can get registered in that list, and whenever a suitable cadaver is available, they can get a kidney.
Okay. Ma'am, last question I would like to take from you is that there is a, people say that drinking water, a good amount of water, like a good limit, or, पानी पीते रहना चाहिए हमें healthy रहने के लिए, especially for kidney. So drinking, there's a saying that drinking 8 glasses of water flushes your toxins. And is it a myth, or what do you want to clear about this, or how much water should be intake in a day for having a healthy, kidney health?
One should be keeping adequate hydration, and adequate hydration for a normal individual is considered when any patient is able to produce like 1.5 to 2 liters of urine. And it is recommended that we should be at least taking 8 to 10 glasses of water per day. Okay. This is for the normal individual, that we have to keep our system hydrated. Right. But yes, some patient who has got a kidney disease, Based on their kidney functions, we advise water restriction, whether it need to be restricted or it can be taken as per the requirement. That is decided by looking at the kidney function. But for a normal individual, definitely they should keep themselves hydrated and take at least 8 to 10 glasses of water per day.
Okay. So it is not a myth. Basically, you should take adequate amount of water.
Yes, definitely. You should take adequate amount of water.
Okay.
So that you produce adequate amount of urine. And of course, urine, through urine you pass your toxins and other waste product.
Right. Okay, so I think this was a whole lot of set of my questions which I wanted my audience to know about from through you. So thank you so much for joining HealthWire and giving your insights to us. Thank you so much, ma'am.
Thank you so much.
Yeah.